Welcome to the Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society. Produced by HCPLive and hosted by Skin of Color Society leaders, the Skin of Color Savvy delves into the latest research, clinical insights, and culturally sensitive care practices in dermatology with the leading experts in the field. And today we have a really special episode for you. We're going to be doing a closer look at aligning care for our psoriasis patients that have skin of color. Now, my name is Mona Shahriari. I'm an associate clinical professor of dermatology at Yale University, and I am joined by my good friend and colleague, Dr. Jennifer Soung. Do you want to introduce yourself, Jennifer?
Thank you so much, Mona. Hi, I'm Jennifer Soung. I'm a dermatologist and clinical researcher at Southern California Dermatology in Santa Ana, California. I focus on medical derm and clinical research and have a passion for treating chronic autoimmune diseases, diverse skin tones, and increasing healthcare access to underserved communities. Great to be here with you, Mona.
Well, it's so great to have you because I know you and I have had conversations about improving the care of our patients with skin of color in any arena of dermatology, whether it's clinical trial design, whether it's access to trials, whether it's just how do you diagnose these patients and get them the treatment that they need. And I feel like this is an area where we've had so much improvement over the last several years around the dermatology landscape. I know in my personal training, skin of color was not something you'd really see or learn about. And now I think we're privileged to have so many options out there. But why don't you just start us off by telling us what inspired your interest in studying and treating psoriasis, in particular in those with melanin-rich skin?
Wow, gosh, my interest in psoriasis started during medical school when I began doing research with Dr. Mark Webwall. And what drew me to dermatology at the time was the immunology of autoimmune conditions. I was fascinated with the concept of biologics. And specifically, skin of color, I like to use the term diverse skin tones. You and I have talked about this a little bit.
Yes.
Historically, that term may have a lot of assumptions and often refers to just one race or ethnic population. But we're here talking about any patient who has more pigment in their skin, and it's really the biology of the skin. So I like to use the term diverse skin tone. I've been passionate about this because it's been under-recognized for so many years. I chose to train in New York City because I wanted to be sure that I saw as many conditions as possible in many different skin tones and racial ethnic backgrounds.
Actually, I didn't realize that that was one of the reasons why you want to be in New York City, because going from coast to coast, it's definitely a huge jump. But I think that was a really nice way to do it, because when else do you have that opportunity to really learn from our patients that come from a variety of backgrounds as well as a variety of different skin tones? Now,
Right.
you and I both know that when you have a little melanin in the background, certain skin diseases can look different. Psoriasis is no exception. So, are there some tips or tricks that you have to better visually diagnose psoriasis and maybe some watch outs for our clinicians on this call?
I think for me, it's taken practice over the years, even though I'm someone who specializes in psoriasis. There's certain situations I've certainly been tricked. However, I think to start with, the erythema is not as bright red, so severity of disease is often underestimated. Even when we photograph patients, sometimes in the right lighting, you may not capture that deep violaceous erythema or subtle erythema. Sometimes the lesions are often thicker. So in darker pigmented skin, sometimes the scale, that classic silvery scale that we see in psoriasis can be really micaceous, or even keratotic at times, right? Some patients are itchier. I find that my Asian patients are very itchy, and often there was one particular case I literally thought she was atopic dermatitis because she had excoriated every single lesion, so it didn't look like a classic psoriasis plaque. It looked more like chronic subacute atopic dermatitis. So in these situations, while psoriasis is usually a diagnosis that's made clinically, there are some situations where I recommend and I do a biopsy. So we just want to make sure we're going down the right path. Our systemic medications now are so targeted that you do need to be able to distinguish between atopic dermatitis and psoriasis. And then ultimately, post-inflammatory dyspigmentation is a huge part of this condition. We often assume that if we just simply clear the psoriasis, that okay, done, patient happy. And we have to recognize for these patients with darker skin pigment, that is a spectrum of their psoriasis. So I even wonder in clinical trials whether our scoring system should include dyspigmentation. Literally, the PASI score was created, or PGA, IGA created for white skin. It doesn't
Mhm.
include hyperpigmentation or hypopigmentation. And when patients come in, they're like, I'm so excited you're clear. And they say, wait, Dr. Song, I still have a mark on my skin and I don't look normal. What
And
about you, Mona? What else would you add?
yeah, well, I loved your comment about the dyspigmentation because the reality is it's not included in any of our measurements of disease severity, but arguably it's a bigger deal for our patients than the skin disease itself. And I can't tell you how many times I've had a patient come back and tell my medical assistant their disease has not improved at all after they started a biologic. And I walk in the room, I'm like, you're completely clear. And they say, no, no, the dark marks are there, to your earlier point. And so it's important to not only educate the patients, but to include that potentially in our measurements of disease severity. Itch is another one. We don't think of psoriasis as being itchy, but I do find our skin of color patients are even itchier. And this is a fun fact. Psoriasis actually means itch. I recently figured that out. So I feel like it's something you don't think about. You always think of AD as being itchy. But what I always actually tell my residents is when it comes to skin of color, whether it's psoriasis or any other disease, you have to broaden your color palette. I had a mentor of mine tell me this back in the day, and that really stayed with me because what I think a lesion should look like or what I think the classic textbook definition is doesn't always apply to the person that's sitting in front of me. And I also tell my residents, when in doubt, take your dermatoscope out. Because when you think of polarized light, which can help you distinguish between erythema and non-erythema, pigment and non-pigment, that polarized light that your dermatoscope has can actually help you quite a bit in clinical practice. Like we hold more cards than I think we realize.
100%. And I tell my residents that if your patient is not responding to a highly effective biologic or advanced systemic therapy, we need to revisit the diagnosis.
Absolutely. And speaking of revisiting the diagnosis, you mentioned that you tend to biopsy patients a lot. I literally had this earlier this week where I didn't know if the patient had a psoriasiform AD or they had psoriasis. And my medical assistant asked me, they said, is the reason why you biopsied because they have melanin-rich skin? And I was like, yeah, I need to be sure. So are there times when you have patients come to you who are misdiagnosed or they come to you at a more severe stage because they didn't know what the diagnosis was or they were getting the incorrect treatment?
Absolutely, many. When there's misdiagnosis, there's a delay in treatment, and that means greater consequences or impact on the patient. So the immediate impact is really the physical component you talked about, itching, pain. And then you start thinking about the chronic cumulative effects of psoriasis. And that's including the psychosocial impact. And in some of our populations, it may include financial consequences. If it's not treated and it's in a very visible area, they may not be able to get a job and they may lose their job. So, in this population, there can be even greater consequences beyond simply just daily life, but go on to changing their trajectory or the career that they choose, or even having a family. So, recognizing psoriasis in different skin tones is so important. I had a ICU nurse who saw me who's Vietnamese Middle Eastern, came to me with a pretty convincing story that she's had this skin rash ever since she was a child, super itchy, atopic dermatitis, partially treated on a traditional oral systemic. So when she came to me, I thought, okay, this is reasonable. This is atopic dermatitis. Started her on an IL-4/13 inhibitor. And then a year later, she ran out of medication. It really took away her itch. She was really happy, but didn't really solve the skin lesions much. And she had run out of medication for a month. And so now she came back with all of her skin lesions. And there was a small area on her back where she couldn't scratch anymore. And there was a well demarcated sulfury plaque. And I thought, oh
Wow.
my God, how could I miss psoriasis? And in fact, now she's on an IL-17, doing amazing. And several things. It was the itch that distracted me a little. Not that I didn't think psoriasis couldn't itch. However, her skin lesions had been so excoriated, couldn't recognize that classic plaque anymore. On top of her skin tone and then the history. So I certainly have been stumped.
Well, and
And
I think
yeah,
And as a psoriasis expert, national and international, when you say you're stumped, I think it's a little humbling for the rest of the world that, you know what, if you're not sure, it's okay. If you have to go back and biopsy after you've tried a treatment that's not working, because to your earlier point, we've gotten really good at treating psoriasis in 2026. So if your big gun drugs are not working, I take a step back too and I say, you know what are we missing here? And I think there's a lot happening right now in the dermatology space about the importance of early intervention for psoriasis. And that's what we struggle with our skin of color patients, because if we're delaying the diagnosis, that means we're delaying treatment, and potentially the disease that's left behind is harder to treat. And we might not even be able to put it into remission, which is the thought process in 2026. If we treat early and we treat it hard, maybe the disease doesn't go on to do everything that it does. And I guess my question for you is, how do you think we can get our patients into our offices sooner and get them that diagnosis when it's appropriate?
I think that question's complex, and I totally agree. I feel like our healthcare system right now is really designed more, I like to use the term catastrophic care, because it's when patients are really bad. So you're really flared to the point where you have extensive body surface area or the patient can't work anymore.
Hmm.
So we know that studies and our data shows that early treatment improves outcomes for patients of all different skin tones. And one thing that is unique to our diverse skin tone population is that they often lack access to healthcare or maybe mistrust the healthcare system. So, addressing these inequalities starts with establishing trust, meeting those populations in their communities, and understanding their challenges. So, in my personal practice, I like to use telehealth to make access to healthcare more convenient with less time away from work, less travel time to the clinic, and for the physician patient relationship, an approach that respects cultural sensitivity, I think, is critical in establishing that trust with individual patients. I realized I was not going to be able to know every single culture out there. And what it really starts with is curiosity, is asking the patient simple open-ended questions. Hey, I'm wondering if there are any skincare routines that are unique to you or your cultural background you'd like me to know about. And patients get so excited, like, wow, she cares. They don't expect that I know everything about their culture. And so, what I'm getting at is I think the future of dermatology and healthcare is one that personalizes treatment in a way that is scientific and deeply human.
Well, I think that's such an important point because the way the world is evolving, the patients that made up a minority in our clinical practices are probably going to be the majority in the not so distant future. So now is the time to learn to not only diagnose skin disease in our melanin-rich population, but also how do you have the conversation that builds the trust? It's funny because I never intended to be a skin of color expert, but people would just come to me. And one of my patients asked me and was like, you know what, you look like me, so you must know how to treat my skin. And that was the aha moment for me that that's what patients think. They assume that there's a relationship there just because there's those similarities. And I think we can capitalize on that. But even if you're someone who doesn't have skin of color, with that sensitivity, with that asking of permission and being curious, you can still gain the trust of your patients so that we can give them the care that they deserve. Because we both know it's so important to be treating diseases like psoriasis early to optimize outcomes. Now, I'm going to shift gears a little bit. I know we kind of talked about the burden of psoriasis beyond what we can see, because the skin doesn't always tell us this whole story. There's a psychosocial impact that we have to keep in mind. And what are some of those psychosocial burdens that you prioritize when you're having conversations with patients? And how do you plug them in with the right specialist if there is a mental health component that you need to address?
Wow. I think one that can be really complex in a dermatology visit. And so I like to I'm going to start that part over again. That can be really hard in a dermatology visit because we're trying to deal with so many different things. We're trying to take care of their skin, and then we want to address potential systemic comorbidities and then start a new medication. It can feel really overwhelming, especially when you're trying to be efficient. So I've learned over time is to let the patient guide you. So, one of my favorite questions to start the visit is to quickly get to the purpose of the visit for perhaps a new patient or a new concern, is asking them, hey, how has the psoriasis impacted you? And sometimes patients start crying because no one has asked them that question.
Wow.
Many patients will share feelings of embarrassment, social stigma, especially when they have psoriasis in really visible locations. And I had a recent patient who came to me in his recent, uh, in his mid 30s, and he'd been using topicals for years and kind of gave up on his psoriasis. But he thought, you know what? It's in areas where I can wear my shirt and it's hidden. And one day he took his kids to the beach, and his kids were like, "Come on, Dad, you have to get into the water." And he's like, "No way am I taking off my shirt." And I just kind of learned to live with this over time. But he decided, I'm going to get into, I don't want this to interfere with what I do with my family or the activities that I get to do. Took off his shirt, was about to get into the water, and a total stranger came up because he could tell that he was really embarrassed. He had all this psoriasis on his chest and back, and said, "Hey, you don't have to live like that. You have to see my doctor. She changed my life." And so this is what like we can do as dermatologists. One, we have this amazing ability to help patients feel normal again and clear their skin. And it's that connection and collaboration of why we all went into medicine.
I couldn't agree more. And I think the multidisciplinary approach is so important. But to your point, I sometimes do a couple of visits where at my first visit, we talk about, okay, this is your psoriasis, this is your diagnosis, let's treat it. And then I'm like, but just so you know, psoriasis doesn't happen in a vacuum. It can impact other aspects of your body. And so let's have a conversation about how else we can optimize your care at your follow-up visit. And sometimes doing it in that way, I know not everybody has the flexibility in their schedule. I'm privileged to own and run my practice, so I can kind of make it work the way that I need to. But I think that definitely makes a difference that we're not overwhelming them, but also giving them the care that they need. And those younger patients, I'm telling you, they get so excited. I had a guy just yesterday when I told him I was going to start him on a biologic. He's like, "I could just kiss you," and I'm like, "That's okay, but let's start your biologic."
I love that. It means that patient left feeling heard and seen because you took the time to listen. And I think the fear is we think that if we let the patient talk or freely, that they might just keep talking forever and we're going to be in this room for a long time. And interestingly, I just learned this recently, is that if you let a patient talk, they will talk in a medical visit at most around 3.5 minutes. Because
Oh,
they also
interesting.
are aware that you have limited time and they want to be respectful too. So I do think that the best care is how we communicate that confidence and trust in our visit often determines treatment success.
Well, and let's take it to the next step. We both know that efficacy alone does not determine whether or not someone is going to stay on a treatment or continue on treatment, even if they trust you really well. There's other elements that come into play. Is the treatment the right fit? Does it fit in with their daily routines? Is it realistic in terms of maintaining it long term? Like both of us, we treat skin of color patients who have scalp psoriasis. If you have afro textured hair or tightly coiled hair, and I'm giving you a shampoo to use every day for the foreseeable future, you're not going to do it. That's just not the right tool for the job, so to speak. So, are there any nuances that you keep in mind to ensure you're kind of matching the right treatment with the right routine and route with each individual patient?
Yeah. You know what? It sounds overly simple, but on the follow-up visit, I'll just ask, are you happy with your treatment? It literally is because I think for so many years we assume that it's just about clearing the skin, right? And so when we talked earlier about the patient comes in and we're like, "Oh my God, your psoriasis is clear." They're like, "Wait a second, there's still discoloration." Or they'll tell you if you ask an open-ended question like, "Are you happy?" They're like, "Well, I don't like the injection." Or the injection kind of hurts. And so more and more, I know it's terrifying, but listening to my patient, I have learned the most.
Well, and I love that point to just ask the patient because we sit here going to lectures where people spend 60 minutes trying to tell us, okay, what does your patient want? And I think your response is the simplest and it doesn't require me to use any manpower. And you'd be surprised. The person who I think might want a pill wants an injection. The one who wants an injection might want a pill. And that same patient may change their mind throughout their psoriasis journey. So it's just important to stay current with them throughout that time.
Absolutely. And when we talk about treatment preferences, Oh my goodness. We have so many treatments for psoriasis these days, and it can be really overwhelming. And so I like to simplify it. You don't need to know every single advanced systemic treatment to be able to effectively treat psoriasis. I say choose your favorite oral, your best IL-17 and your best IL-23. And that's an amazing place to start. Get familiar with those. And you can probably treat the majority of psoriasis to clear or almost clear these days. And the other component is really just understanding what the patient's individual preferences are. And that's why I start off with that question. Tell me how it's impacted your life. Recently, a patient came in. I really want clear skin, but don't kill my immune system. So
Okay.
I was like, I knew where his starting was. He was concerned about safety. And so we started with understanding is, what is psoriasis? We're here to normalize your inflammation. I want your immune system to function perfectly. And treatments these days are so targeted that we can do that effectively and safely. And so I knew right away what his concern was, and I could address that directly. And we had a very efficient way of starting our visit. I'm always looking for ways to, one, optimize what we're going to do because patients come in with so much information now. A patient often recently came in and was like, hey, Dr. Song, I did a search on AI. I said, great. I am so happy you're learning about your skin condition. Tell me what questions you have. And so we're
I
evolving
would have
and
had a different answer, but okay.
we're different. Like we have to evolve with the technology and the information. And so I start with acknowledging the good, which is, I'm so happy you're interested in learning more about your skin condition.
And we have to meet them where they are too, because sometimes we sit there talking about, okay, a once a day pill versus an injection that's less frequent. But to some people, injecting and forgetting is their preference because they don't want to think about their disease every day. But to your safety point earlier, for someone, maybe popping a pill every day and deciding, I don't want to pop it anymore, and now the medicine's out of my system quickly, maybe that is what gives them comfort. And at the end of the day, if we can treat our patients, it's not really on me to decide which route it is, as long as we're the ones guiding our patients through this journey, which we know is a lifelong journey.
Right. I love that keyword you used, guide. And so I use that often. And sometimes we meet a psoriasis patient on their first visit. They're nervous and they're not sure what to think or where to start, which one to choose. And I tell them, hey, my job here is to offer you options, guide you, support you, coach you because it is a chronic disease and in a good way. Not that we're definitely looking for a cure, but however, right now we have great treatments to help patients manage their disease in an amazing way. And so I'm here to support you in that journey. Honestly, when I started my career in dermatology, I never thought I would be managing chronic disease or knowing my patients. I've been practicing now 16 years. Some of my patients I've known for their entire life. And I'm like,
Wow.
wow. And so a recent patient, these are some of my favorite stories, came in and I've known him for 15 years now. Started on Taltz early on and did amazing to the point where he wanted to get a gastric sleeve because he was just so happy with his skin
Wow.
that he wanted to lose weight. Many years later, and he's been doing great. Many years later, recently on a routine visit, I see my psoriasis patients who've been doing well. If they do well after their first year of a advanced systemic, I see them once a year or twice a year. And so this was his annual follow-up visit. And he came to me and he goes, Dr. Song, you have no idea on last time when you checked my routine labs and you noticed this slight difference in a slight anemia, and you asked me, have you been drinking? That moment changed my life. I was too embarrassed to tell
Wow.
you that I was an alcoholic and drinking all the time, even at work. And so when he came back to me, I was like, did you start a new exercise routine? Because he had lost more weight. And these days, you never know if your patient is on a GLP or not. People just don't want to
I
tell you.
know.
So I just said, hey, did you start a new exercise routine? He's like, you know what? You changed my life again. You helped me. You prompted me to stop drinking. And I was like, oh my gosh, like the amazing things we get to do as physicians taking care of patients with these systemic autoimmune conditions has been an amazing journey for me. So going back to kind of, you asked originally, like, how do we address all the personal preferences that our patients have, and there's so many choices. A recent analogy one of my friends shared with me, I really like, and it has to do with the best shoe salesman. Not that we are shoe salesmen, but I really like this kind of simplified way of looking at it. So, the best shoe salesman will only ever give their client two options. Because if you try on more than two pairs of shoes at any time point, you get overwhelmed. You're not going to be able to choose.
I like that.
Any time point, he's always like, this choice or this choice. You don't like one of them, we're going to put it away. You can try on another pair of shoes, and not until you have to get rid of one. And and so what that really means is like our job as dermatologists, physicians, is to help that patient narrow down their choices. And for me, that's why I start the visit with open-ended questions like, tell me how this impacts your life. Tell me what your goals are. And then you help that patient narrow it down to two choices.
Absolutely. And I think the other piece of it, especially in our patient with skin of color, is the safety conversation because that comes up. Has this drug been studied in someone that looks like me? I'm a little different in terms of my genetics. Like, are there any side effects that I need to worry about? And when you're thinking of the options out there and the fact that people come to you with ChatGPT information on their phone, how do you gain that trust and really dispel some of the myths that they may have read about without making it seem like what they're saying is completely ridiculous?
You know what? These days, I acknowledge. It starts with acknowledging. And great, I love the fact that you're learning more, or you may be right. Let's explore this together. And I find that that really establishes trust. I think for anyone, it doesn't even matter if it's a conversation about their healthcare or whether you're working with your staff and they come to you with a concern or a question, first acknowledging it and then from there understanding it, help me understand, tell me more, and being curious in every part of our life I've found so useful.
I love that. And so we're coming up on time. So are there any last minute pearls that you have for any of our clinicians that are listening in terms of how they can best treat our patients with skin of color of psoriasis and help meet their needs?
Wow, I would say I would encourage and more doctors to treat these patients. And that's why I love sharing my stories because I find so much joy in taking care of these patients. It is a lot. And so hopefully you've learned some pearls about how to manage that visit so it doesn't feel so overwhelming. And like what you do, Mona, divide it up into a visit. Today we're going to take care of this. Next time, I'd love to explore and get into your other health conditions to see where that might play a role in your systemic inflammation. It is such a unique place where we are in psoriasis these days. We have so many tools to really help patients live their best lives.
Yeah, I couldn't agree with you more. It's a very revolutionary time, and we have the privilege to take care of these patients. So I definitely want to make sure that we are including all aspects of the conversation, whether it's the efficacy of a drug, the safety of a drug, and also what comes with adherence to a therapy, whether we're talking about a once daily pill, we're talking about an injection every several weeks. So again, there's a lot that comes into the decision making, and it's nice to be able to have the tools to be able to best serve the patients that we see every day. Well, thank you so much, Jennifer, for this engaging conversation. I always learn so many pearls when you and I chat. And now I'm going to use your tidbits when someone comes to me with a string of questions and information they found on ChatGPT. So thank you so much for sharing your insights with us.
Thank you for having me today.
And we hope that you found today's discussion informative and inspiring. If you're interested in learning more about the Skin of Color Society and its impactful work, I encourage you to visit the skinofcolorsociety.org. Please don't forget to subscribe to HCPLive's newsletters and follow us on social media to stay up to date with the latest in dermatology and more. We'll be back soon with another episode, so be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. Until next time, take care and thank you for listening.